Thank you, Ruth. Can we see the slide on Mind the Gap? That's it. I really like this cartoon depiction of a gap in health literacy because there is truly a gap between the patient's caregivers, what they currently know, and what they should know. There is a gap between the vocabularies of healthcare professionals and that of the patients. There is a gap between the health literacy rate of first world countries as against the low middle income countries. And APIS tries to bridge these gaps and hopefully eliminates it in the years to come. But first, let's see what transpired last year. We described and defined health literacy last year to make sure we are all starting from the same page. We had two distinguished speakers, Richard Vines and Ranjit Kaur, who explicitly said health literacy is not only about providing information to patients and caregivers, but also involves empowering every stakeholder in the healthcare ecosystem with credible information, which, and these are crucial takeaways, can be accessed, understood, and acted upon by everyone. Hence, at APIS, you have always hear us mention a call for action. During the discussion, they both concluded that health literacy is an important step in improving health outcomes and allowing people to make better, more informed choices. And also, allowing healthcare providers to communicate effectively to facilitate the patient's articulation of their own problems and issues. We had an emotional session with Dr. Emily Isham, who shared her personal experience with her late son, who was diagnosed with cancer. She shared her sufferings despite being a healthcare provider herself to fully understand the disease and its consequences, and what she had to do to become a responsible, knowledgeable caregiver to be able to navigate this difficult journey. She focused on key hurdles throughout the journey due to low health literacy. She mentioned key tips and reliable sources of information, and also key questions to ask your treating physician. There was a discussion on the challenges and gaps, which included lack of access to validated information, barriers to comprehending information, including the use of scientific, medical jargon by healthcare providers. There was also a discussion on barriers to evaluating and navigating information, especially those found on the internet. And lastly, education, communication, and language barriers. A sample publication of the Breast Cancer Welfare Association of Malaysia was presented last year, depicting a guide for both patients and caregivers and also the healthcare providers. They said any guidance note should be clear and simple, with empathy, visually appealing, have a positive tone, and most importantly, the contents should both be validated by patients and healthcare providers. And as a consequence of all the takeaways for health literacy last year, APIS 2022 was able to come up with the Health Literacy Guidance Report and handout, which are now available in the APIS website for everyone to download and use. So this aside, what are we expecting this year from APIS? In particular, this topic. Can we see the slide for the agenda? Okay. For today, we will start with hashtag Care Unblock. Unblock actually is a Novartis call to action, a campaign targeting cardiac health. However, hashtag Care Unblock is not only about targeting cardiac care, but it is a trial to demystify the misconceptions and misinformation blocking the right care and proper disease management. The discussion will revolve how patient organizations can bridge the gap between the patient community and the healthcare providers community by driving the right awareness to facilitate meaningful conversations that can result in better informed decision making, and better outcomes. We will have on board our distinguished speakers, my fellow APPIS 2023 Council member, Professor Mahira El Sayed, Professor of Dermatology and Venerology of Ain Shams University, and board member of the International Psoriasis Council. We have Dr. Hani Sabor, Assistant Professor, Cardiology, Brown University Medical School, and Consultant Cardiology and Pulmonary Hypertension, Abu Dhabi. Also joining is El Amira Nermin Sakaria, founding member of Psoriasis Patient Organization, Egypt. And to moderate the discussion, we have Reem Adil, Director, Patient Engagement Country Partner, Novartis Innovative Medicines, China and Japan. After that, we will then have lessons learned from China, which will be presented by Stanley Li, founder and chairman of DXY China. And last but not the least, we will have BG Vekantesh to present measuring the impact of health literacy in India, to be culminated with a fireside chat with yours truly. So before we start with hashtag CareUnblock, what a better way to start the session than to watch this video of a role play between Dr. Hani Sabor and his patient.